Problem Solving. Today I am here to give over my voice on about a 56-year-old female who presented to us with pericardial effusion, which is an unusual presentation of multiple myeloma. So to begin with, she's a 56-year-old female presented to our OPD one year back with complaints of skin edema, shortness of breath and chest pain. So, and when there was a challenge of pericardial synthesis as she landed up in cardiac tamponade, we finally made a diagnosis of multiple myeloma, which is causing her pericardial effusion. And she was on induction therapy and maintenance therapy for about 9 months and remained in remission. And in the month of December 2021, she suddenly had orbital hematoma as well as purpuric lesions distributed all over the body. So the etiology of the purpuric lesions that she had as well as the orbital hematoma was considered that it is secondary to amyloidosis, that is because of multiple myeloma. So, and in the month of January 2022, all of a sudden she had a sudden cardiac arrest at around 7 p.m. on 18th of this month, which was thought that her sudden cardiac arrest was because of ventricular assistance or heart blocks that are usually the cause of sudden cardiac arrest in patients with multiple myeloma having cardiac amyloidosis. This is the gist of the case presentation today. The case was already being discussed with Dr. Binod sir, whose chief interest is on novel drug treatment for the ongoing multiple myeloma patients as well as a spectrum of classes and licheriasis. Sir also added a note about the usage of daratumab monoclonal antibody for this patient, which would give us a better outcome. He also added a note that this patient can also be given the anti-fibrin molecules as well as humanized monoclonal antibodies, which are still a very keen aspect to focus on. Over to Dr. Binod sir to give his inputs on this patient of multiple myeloma.
Thank you, Rashmitha. Thank you, Dr. Rakesh. First of all, thank you for inviting me. So this is a very interesting case. I was trying to get the gist of what's happening to this patient. And if I had to summarize, I think Rashmitha did a great job in summarizing this case. But it looks like, she was diagnosed with myeloma and an initial presentation with the pericardial effusion, which is kind of one of the extramedullary presentations of myeloma. Then after that, she was treated with induction treatment, and then after that, she was put in maintenance, iron-sensitive stem cell transplant. And after 9 months on being in remission, she had a recurrence, but at the time, with the secondary amyloidosis. Unfortunately, the patient passed away with sudden cardiac death, which Rashmitha said is common in patients with cardiac amyloidosis. So we have a lot of data points here, and in trying to get kind of a gist of what is happening in this patient. If you look at the initial presentation, and if I understand correctly, the initial presentation is from pericardial effusion, right, Rashmitha? So if you look at the presentation of myeloma, the presentation of myeloma with the pericardial effusion is very rare. As you all know, myeloma is a disease, of the bone plasma cells, and the famous acronym, the CRAB, with the hypercalcemia, renal damage, bone lesions, and then anemia. Those are the classical features of myeloma, like the major organs that get affected. In some cases, and rarely, sometimes you can see the extramedullary presentations of myeloma. So myeloma is develops and progresses in the bone marrow. So most of the times the affected organs and the presentation is medullary presentation, but in some very aggressive presentation you can see extramedullary involvement, including the involvement of any organs for that matter. And so having pericardial effusion and pleural effusion is one of those rare presentations. And I don't know this, in detail about this this patient, initial presentation, but this patient could also have what is called the primary plasma cell leukemia, which is one of the very extreme form of multiple myeloma, where the patients can present